Have you ever heard of your body and pelvic floor muscles just never being the same after delivering a baby? I'm here to tell you that that is simply not true. With the right tools and knowledge, symptoms such as urinary incontinence, constipation, pelvic pain, prolapse, and other issues that we experience in the postpartum period and during pregnancy can be treated and can be prevented. This is a session for all women who are planning to conceive, are pregnant, or postpartum. It is so important for all women to truly understand what the pelvic floor muscles are, what the function of these muscles are, and how they support us through life, only because there are so many issues that can be prevented in the future just by understanding this part of our body. My name is Krisia Gattas. I am a doctor of physical therapy specializing in pelvic floor rehabilitation, and I am the founder of Pelvic Therapy South Florida, a leading pelvic floor clinic here in Miami, Florida. During our session of essential pelvic floor care, we will be going over the function and changes that the pelvic floor muscles and the whole pelvis goes through during pregnancy. We'll also be going through what the components of the core are and how the core is so essential in treating pelvic floor muscles and maintaining good function throughout our lifetime. We will also be going through the function of pelvic floor during delivery, what changes and what we can do about it, what those effects have on pelvic floor muscles. We'll also be going through the healing timeline after a delivery, both a vaginal delivery and a C-section delivery. We will also be going through things that we need to look out for that signal pelvic floor dysfunction and how we can treat them. So when I first started, I was starting in an orthopedic clinic, and I saw that a lot of women and men were coming in for low back pain or hip issues, nerve compression in the hip, sciatica, and a lot of people weren't really getting better. After a while, and after I started to specialize in pelvic floor dysfunction, I realized that many people don't end up getting better from other conditions in their body simply because there is no awareness and there is no evaluation of the pelvic floor. The pelvic floor is a main part of our body that supports all of our pelvic organs and therefore supports all of our upper body and creates a hammock for the bottom of our body. So I saw that during pregnancy and postpartum, especially, there is such a general lack of awareness of the importance of pelvic floor function. This is causing a lot of issues such as leaking urinary incontinence, prolapse leading to major surgeries, which cause other issues, as well as pain overall in the body. Women are very unaware of the fact that these issues not only can be prevented, but if you do have them, if you are experiencing any of these issues, they can be treated for a better quality of life. I think during the postpartum phase, many women focus on getting their body back, or there's a big focus on, let me do everything that I was doing prior to pregnancy, which is great, right? These are things that we want to get back to. We want to get back to a prior level of function. However, a lot of women are doing this immediately postpartum without doing any pelvic floor rehabilitation or even realizing the big impact that pelvic floor has on all these things. So this, not having the awareness, leads to the issues such as urinary incontinence, fecal incontinence, prolapse, pelvic pain, weakness down the road that can lead to other issues that are even bigger than that, such as surgery, not being able to hold your urine when you're standing in line, bigger things that really impact quality of life. I am here to tell you today, it is not normal to leak when you sneeze after having a baby. It is not normal to not be able to go on a trampoline with your kids because you're going to be so afraid of leaking while you jump. All of these things can be prevented, not only prevented, but if you do end up having urinary incontinence or you have pelvic pressure, pelvic pain, any of these issues, they can be treated the right way without you having long-term effects in the long run. My name is Krisia Gattas. I am a doctor of physical therapy, and I specialize in pelvic floor dysfunction. My specialty is treating the pregnancy and postpartum population, as well as patients with pelvic pain and bowel and bladder issues, and I treat both men and women. I am the proud owner of a physical therapy clinic that specializes only in pelvic floor dysfunction here in Miami, Florida. And I have about 6 years of experience just treating pelvic floor. I graduated from New York Institute of Technology with my doctorate. And since then, I've been focusing on different areas of physical therapy until I found my specialty in pelvic floor.